All right. This woman is saying she has back pain and shoulder and neck pain. What do you see?
Shoulder pain and neck pain, back pain. Yes, for me, the always is the sidelines. I look at the back and I look at the sidelines. So if you look at her side, wow. Okay, first, right? Draw that plumb line, Dr. Reese. It never lies. Wowzers. I
Look at the
bet her neck
glutes.
hurts. Yeah. She's a classic anterior pelvic tilt, right? And that's why her low back super hurts. Like she's got strong quads, strong psoas, weak abdominals, strong glutes. It's just out of balance. And then therefore, her shoulders, she tries to pull them back, but she can't properly retract. So she goes into depression, which is pulling too hard. And then the only way the head goes forward and it's exactly what you see there. It's like, I'm going to pull my shoulders back for good posture, but the head can't follow because the spine isn't there.
And she's got what I call turtle posture too. Look at her neck is falling out onto her chest. It's like, look at this.
So remember when you talked about those trapezius?
Her ear is supposed to be here.
So that means her trapezius muscle on the top, really strong.
Really strong?
Really strong. Otherwise, like it's the only thing holding her shoulders back. Like go ahead and squeeze your shoulder blades back and do it poorly. And then stick your head forward. So all those muscles in your neck, upper trapezius, levators, they're just on and they never get to relax. Right. So therefore she has neck pain, like you said, or the turtle head, but even the turtle gets to go in and out of the shell. She has no choice. Her shell is so tight on the back and she's in hyperextension from her lumbar to her shoulders that she can't bring her head back, or literally she's going to fall.
Let's take a look at the back. This is your favorite.
Back to the side, right? There we go.
It's too bad we got dark clothes here, but.
Okay. Start with the femurs, right? We've got internally rotated femurs. So we know it's an anterior tilt with a weakness, right? I'm kind of trying to educate guys, when you're more externally rotated, they're tonic and tight. When they're internally rotated, they're usually lengthened, or there's a discriminatory between right and left. Here, her left is internally rotated more than her right. And that pops her hips to the left, right? The left hip is weak. We can see it in the knee, and then we see it how it's boing over to the left.
Right.
She probably has a little walk where her quads are probably so tight. Like Dr. Reese, she just needs to do some standing quad stretches, like while doing dishes every day. She'll be a happier girl. And yep. That's
some offset, huh?
It's like offset. Well, think about this one for a minute. When we go into rotation, we have to let one side of the back open and the other side go into contraction, or one side of the erectors work more, the retractors work more, and then on the other side, the oblique muscles work, and the body has to work together. She doesn't have enough movement in her body the way it's stacked, so her neck is really far forward. You can see the shadows of her shoulder girdle, right? Remember I told you they were really creeping up her neck. That happens more for women as well because we have breasts, right? So we have a downward pull and then we put on a harness that pulls us back up. So it's a unique pattern you'll see more in females than males, just because y'all don't have to deal with that extra weight. So she's got two sets of weights going on for her. She's got her chest, which is playing in her mid back. And then she's got her head, which weighs about 30 pounds, sticking way out there. And that's playing in her back as well. So the weight of her head, the weight of her body moving forward, her organs are like kind of dumping. If you can see, like she'd be a prime candidate for really working on her abs and her core. And she probably would be like, that'd be great. But she probably can't get that success yet because we need to work on her quads and her hip flexors. They're just darn tight. Tight. Look at that. And that's okay, but it's just not enough strength. Remember how I was saying the left leg and the left hip were kind of bailing? You can see that on the tone of the quad and the knee. Even the shorts. She
Yeah.
favors one side. She really goes to one side of her body. Granted,
Yeah.
everybody needs to know the picture is crooked, but I think there you can look at her hands too. We know her right arm is not 2 inches longer than her left, right? But that she has a systemic rotation.
Yeah.
Yeah, I would love to see this woman be able to open up her backside, as you say, get her head over her body, work on her vertical load. So this is a vertical load issue. This is where gravity is playing on her posture.
Looks like some pretty severe lordosis here, right?
Yes.
We can't see because her arm is kind of blocking
Oh, we
it.
can see. Yes, because you see her bum right there, how it sticks way out, but it's
Yeah.
sharp. That's what you want to look for, guys. A nice normal curve is good. When you sort of see a bum that goes, that's a really strong anterior tilt and lumbar tightness. It's too much.
Yeah.
Ooh.
Here's some lumbar here. Yeah.
So I don't even think she would do that. Like if we dropped her into that, we would hope her back would open for sure. A little bit, because I would, it's great. Okay, there, yeah. And then go to your other one, your other picture.
Well, hold on.
I was going to say, imagine the way you see that picture with her neck. That's how she's walking around the world.
Right.
And that's in a squat. Hello, Balte. Lovely.
All right. Here's some lumbar. That's what I was looking for.
You see how it's nice and smooth? It doesn't go.
Yeah. Here we got our normal S curve, right?
Yep. So you've got the psoas, the iliopsoas in the front. You've got the erectors in the back. There they are. And then you've got quadratus lumborum and your obliques. Oh, there they are. And your intercostals. And then soon you would have another set of muscles. There's serratus. Yep. And then it just keeps layering on. And they're all interconnected through fascia, through joint load, through organization. And when one thing isn't working, the whole thing isn't working.
Right.
It really is. So that's a beautiful sideline. And you can see that, like there's supposed to be a little bum, there's supposed to be a curve, there's supposed to be a thoracic. And so when people are like, Dr. Reese, what does good posture look like? In an ideal world, that.
Right.
Ideal world, right? Because some people were all born different and we're never going to look like the picture in the anatomy books. But we can have some expectation.
Right.
We always know if we dig you up from the ground and we don't know anything about you, we can tell the difference by your pelvis if you're male or female. We can look at your bones, see what you ate, carbon dating. I mean, the body just doesn't lie. Love that one there. Abdominal training, range of motion. That would be brilliant for the last client we just looked at.
Oh, yeah.
Because she has to retrain her body to look for that rod. In her mind, she can't fulfill, she can't do that yet. She will arch her back, stick her butt way up, and all the weight will go into her knees. So we would retrain that.
Yeah. I wanted to look at the rotation real quick.
Let's do it. Rotation is critical.
Yeah.
So beautiful.
So this woman needs some postural therapy. Could also put her on a nutrition plan, get her corrected, get her going. If anyone out there wants their P-raise examined, then go to the Peace Over Pain Facebook group and get in there and just say, raise your hand. Just raise your hand.
Just like this.
Just like this, right?
Raise your hand. I mean, this is a beautiful picture here. I think a lot of people, once they start understanding, I guess this would be the one. Your arms come from your back, right? We have a lot of relationship with, oh no, this is my arm. My arm is in the front. But even looking at this, right? You can see the collarbone is where you're attached to your skeletal body. That's it. Then your collarbone goes out to the side and it meets up with your humerus and your scapula in the acromion joint. But you can see it's very floaty. We have rotator cuff. We have all of this movement, and all of this movement happens because there's 9 shoulder stabilizers, there's 4 rotator cuffs, there's scapula that need to be able to move, humerus. And most people think, oh, well, no, my arms come from here. No, your arms come from your back. And that is the first part about understanding movement, because look at all these things you can do. But if you're head forward, if you're kyphotic, if you're hyperlordone, if you're any way not in balance, that shoulder girdle cannot do its job.
Right.
Because it relies on the rib cage to function. The minute the rib cage rotates, you will have a neck problem or a low back problem. And people seem so surprised. I'm like, what do you mean my rib cage is crooked? And then we show them a P-ray and you're like, look at this rotation. I think we should celebrate it, because once you see that, you're like, you're not broken. We're just going to get you back on the line. That to me is great. Because most people are like, what's wrong with my shoulder? Doc, what's wrong with my neck? And they're going to tell you, go to PT. I'm going to tell you, look at your posture. Talk to Dr. Reese. I mean, look at this. This is amazing. People wonder, how do we stand up? Well, it's a very complex thing.